Christina.
Hey, Kallie. What's going on?
Oh, just
What
another
are we talking about today?
PRP. But before we get to that,
Yeah.
a little fact of the day.
Okay, hit me.
I thought it was fitting because, I don't know, here in Utah, maybe not in Southern California, we've had our fireplace going, all the things. But according to the NFPA, over 1,300 people get burned by electric heaters or fireplaces in America each year.
I believe it. I mean, for all my wound care heroes out there, I think we get at least, 1 to 2 patients that come in with burns and they don't even know. Or I had one patient, he was sitting in front of a heater and just fell asleep. And like didn't know, woke up, and I think it was his daughter or somebody that was like, "Oh my God, your feet." And so y'all be careful. I know it's cold. It is cold. It's real cold. California is not as cold as everywhere else, but it's cold.
Well, I just when I saw that, I started laughing because I was probably 12 or 13 and we were out by a campfire. So we had a big, pretty campfire pit in our backyard. And my dad was paralyzed in one leg. And I remember he literally melted his kneecap off.
Like literally?
Literally. It I wish smartphones were a thing back then so I could find the picture, but it melted off. So after that day, if you caught my dad around a campfire, he'd constantly rub his pant leg to make sure it wasn't getting too raw.
Like we're laughing about it, but it's not funny. Yeah. But it's also you can laugh about it now, right?
He was laughing about it I couldn't relate. I mean, it's not like it was.
I know, but still, those prosthetics are expensive.
I know.
Yeah. Well, so happy to be here. Welcome back to the Unwrapped Podcast, friends. Today, we're going to talk about PRP. It's, with all the craziness, and Kallie and I were talking today because CMS loves the drama, as we know, as we've discussed. They're just keeping things alive. And so we wanted to really break down PRP. Similar to CTPs, I feel like it's going to take off, and there's going to be so many companies, and we're going to get lost in the sauce, I feel like. So we wanted to bring this episode to you guys to break it down, now that there's 4 different products on the market, to break it down, the differences, to understand it. Who knows? We may have to update this episode with more companies down the road, but while we can keep up on it, we thought, let's do that. So Kallie, what kind of information do we have for them?
Yeah, so we basically did the homework and all the dirty work for you guys, and we virtually sat down and talked with each company, what their product is, how they stand apart. We got into things like how is it stored, what comes in their kit, best practices and recommendations they have for blood draws, for patient compliance, dressings, all the little things that Christina and the team in the clinic have been seeing as they test out PRP. So it was really fun because at least I'm not speaking for Christina. For myself, I went into it thinking, oh, PRP is just this big umbrella. And what I quickly learned is there's little subcategories for each company because none of them are the same.
I think I was shocked about that too. I thought they were just different types of patches and whatnot. But learning and listening from each company was really eye-opening of how they're so different. Not just from how they're stored or what they're spinning and what it looks like, but truly what type of PRP it is, and then what different products or different additives and whatnot make them slightly different. Yeah, super excited for you guys to listen to each of the interviews. Let's be real. You may not have time to listen to all 4 interviews. We get that. Don't worry. We got you. We're going to get a recap at the end. But if you do have time, I think it is actually worth listening to. Super insightful people. I'm really, really passionate about what they're doing and what their company's doing. And so if you have a moment, listen in. We're going to pop those interviews in for you right now for you to listen. And then we'll be back to recap.
Enjoy. Introduce yourself, Michael.
No problem. My name is Michael Tucker. I'm one of the medical doctors with Regen Lab. I've been with the company for about 5 years now. I went to medical school, East Carolina University, after graduating undergrad at Chapel Hill, and took a little bit of a unique route in that I went directly into to industry. It was not something I was planning on continuing to do. I was planning on then going on to residency. I come from a family of physicians. However, I was able to see that there's a lot of exciting opportunities, and I had this unique option to be able to stay and pursue this track. So I've been very happy to working on with physicians and trying to connect physicians and thought leaders in the field, helping set up clinical trials, designing protocols and studies, to bring these new products to the physicians that are practicing every day.
Thank you so much for being here. As you know, we've kind of talked about PRP kind of being the next up and coming product, especially with all the changes with CTPs. And we're just really excited to learn more about how your product stands out against all of these other PRPs. So yeah, if you want to get into it and kind of talk to us about your product, we'd love to learn more.
Sure. Thanks, Christina. I appreciate you having me on the call today. So the first thing I would say that makes us a little bit different than some of the other companies out there that are in this relatively new category for autologous blood-derived products is that you're dealing with a company that has 20 plus years of experience with platelet-rich plasma. So throughout the industry, the aesthetics industry, dermatology, orthopedic, sports medicine, all sorts of different applications. Regen Lab's been working with PRP for some time now. And that gives us many distinct advantages. One being that this company internationally has over 300 publications now with their PRP products. And we've been able to continue to innovate on what makes us unique. I would say another thing that's really exciting for, I think, all of us with this new category, all the different products that are in this category, with the new national coverage determination and some of the new updates that are coming in 2025, is that you have an option to bring growth factors, the proper balance in the milieu of growth factors, if you will, directly to the patient's wound bed. So as we all know, a lot of these chronic ulcers in patients that have diabetes, one of the hardest things is the poor circulation. And so these blood products can be almost a workaround in the sense that if blood's not able to, the growth factors are not able to reach the wound bed through the patient's own circulation, by drawing it from the patient's arm, processing it in some manner, coagulating it, and then being able to apply it directly to a wound bed, you're essentially supplying what that wound needs to go back into normal physiologic healing process. For Regen Lab itself, a couple things that, again, make us quite unique in this category. The first would be that the way we process the patient's blood initially. So we use Regen thixotropic separation gel, and this is a way of fractionating the blood so you're able to increase the concentration of platelets and growth factors while simultaneously decreasing significantly the number of red blood cells and neutrophils. And with a lot of these wounds that are caught up in this chronic inflammatory state that we're trying to break out of, you're already dealing with this overabundance of neutrophils that are recruiting more neutrophils, and they're releasing reactive oxygen species that are destroying the growth factors that are needed for this wound to advance to the proliferative and remodeling stages. And so by having this very pure, concentrated PRP to begin with, that's, I would say, the first thing that makes us quite unique. The second thing that's quite unique about this product is that we are activating, and when I say activation, we're talking about activation of coagulation. So we're going from a liquid to essentially a polymer gel of the patient's own blood product. We have a way to do this using the patient's own autologous thrombin serum, and that's somewhat unique as well. We don't need to rely on thrombin serum from an outside source, but we're able to essentially have an isolated, concentrated form of the patient's own autologous thrombin serum. So you get this very pure product that's just using the patient's own blood, essentially, to create this very pure 3D PRP gel, if you will.
Okay. And so I know, Kallie and I were talking about this. The first SAWC spring this year, there was 2 PRP companies. And now this last SAWC, there's about 4. Where do you see PRP going? Do you think it is the next big thing, the next CTP, if you will, with all of these changes that are happening? What do you see for the future?
Sure. It's a very provocative question. Probably a little bit controversial as well. But I would say with some of the results that we're seeing with all four of these products in the category, it's inevitable that this is going to have more and more of a role in wound care. I think we're still not at the point where it's found its perfect place in the algorithm of treating some of these chronic wounds. But we're getting closer to that point every day as different providers begin using these products. For example, if you have a patient where you might think, well, maybe I should be doing a wound vac, and that might be the right choice, or maybe I should do a PRP gel, because those two things can't be used at the same time. It might come down to the level or the depth of the wound. It might come down to the location of the wound. It might come down to the fact if the wound is highly exudated, maybe a wound vac is the way to go. But if it's very dry and you need better moisture, essentially, maybe a PRP gel would be a better option. But I know that there's a large number, if you go on clinicaltrials.gov or some of these other websites, there's a large number of people that are currently trying to bring new PRP products to the market in this category. And I think they're wise to do so, given the effectiveness that we're seeing with the current products that are currently available.
Yeah, I really liked your example, because I think, with any product, I don't think you can use only one product on a patient. It does come down to what is their medical history? What is their wound presenting like? I think as clinicians, we should be able to adapt and really face value of what is the wound showing us today and what do we need to do with it. I think that's really important, and not just kind of defaulting to one product and use it no matter what. Because I think, again, patients, it varies what the wound's going to look like. Just to go back to your product specifically, because there's multiple choices now in this category. Can we talk about more of how do we store your product? How does that differ? Are the components within your kit, is it different than what's kind of out there? And what would make yours in a way simpler or easier to use because of how your product's packaged?
Sure. So one of the nice things about the Regen wound is that these products can be just stored at normal room temperature. So there's no special storage requirements. They're all designed and intended to be used at the patient's point of care, right there at the bedside to be prepared. So the blood is drawn and then used freshly and then able to be applied. This would be the case on a weekly or biweekly basis, depending on what the provider feels is best for the patient's need. With Regen Lab, you're also going to have a centrifuge that would be provided as well, and that's critical for helping with that cellular separation process. It's a short centrifugation, so 5 minutes is all it's going to take there. And then we're going to have all of the different types of accessories that one would need to perform the next steps, such as a sterile container where you can be preparing the gel. And so you'll have all those different supplies ready right there at the patient's bedside when you're buying the wound kits themselves and the associated accessory kits that come with them. So I think that's a huge advantage as well, is being able to just open the box and have everything you need right there in front of you to prepare this. And I would also say most of the providers that we see that are using this product now, the Regen wound, is that there can be about a 5 or 10 minute process where we have the coagulation, the activation of coagulation. And at first it thought, oh, is this adding 5 or 10 minutes on my day for each patient? But really what we're finding is they prepare this, or they have one of their staff that's working with them that's helping them prepare this. And then let's say you would go and then perform the debridement. And by the time the wound bed's prepared and ready, that gel is going to be ready to be applied as well. So I think that this system fits very naturally into one's clinical practice for treating these different types of wounds as well.
As you guys all know, big patient advocate over here. So how are you guys seeing patient compliance? Because I love that there is really no extended patient visit, right? Because we want to be mindful of that patient time. But how is the overall compliance, and how often are they receiving this treatment?
Sure. So it varies. And again, of course, patients and taking care of their wounds. Christina, I'm sure, as you know, it's a highly there's so many confounding variables. There's so many things to take into consideration. Each patient, each wound is highly unique. But I would say when you're approaching these wounds, you have to make a decision on how often am I going to be doing this treatment. A lot of times you can decide after you come back after the first treatment, let's say 1 week, you come back and you see that you now have granulation tissue, that the wound gel has been completely essentially resorbed. That patient might warrant another treatment then and there, which would be in accordance with what Centers of Medicare and Medicaid are allowing for the reimbursement on this. With some patients, depending on their ability to get into the office and actually have that be a weekly treatment, that might not be realistic. And we have many providers that will spread that out and have the interval be 2 to 3 weeks. And that's perfectly reasonable. And some of the clinical publications that exist on these products had that 2 to 3 week interval. But we've seen it where it can very reasonably be done with the 1 week interval as well, as again, that Regen wound gel can be essentially resorbed in that period of time. Regarding the patient's compliance and adherence with this, I think it was one of the things when I first started that I was concerned about. I was worried about, is it going to be uncomfortable for them having this liquid gel on their wound bed if they have sensation there? Is it going to be something where we have to worry about maceration because there's that liquid component as well? And that might cause irritation or a patient to not desire to want to continue with this kind of treatment. One of the things that's been pleasantly surprising is that the patients are doing very, very well. And we even had patients that might have a chronic discomfort associated with their wound that have come back and said within 24, 48 hours of having the wound gel on, they're not having as much irritation. So we're not seeing really incidents of where this is bothering them. But if anything, it's either not affecting their attitude towards the wound or it's improving their attitude towards the wound. And of course, when they actually get the results and the wounds are healing, that's our goal. And that's what we want to see.
I wanted to ask, as a few of our centers have started PRP, the biggest complaint and the biggest hurdle we've come across is the blood draw. I think for most of our centers, a lot of the nurses, they haven't drawn blood in a long time, or, for a lot of us, we've only ever done wound care. So it wasn't really, something we did. So that's always one. But the second is how hard of a stick our patients can be, just because our patient population is older. Have you seen that in other facilities? And what are kind of maybe some pieces of advice you could give for us to bypass that struggle?
Sure. This is something that it's not my first time hearing this concern. As you say, a lot of times these older, more elderly patients that might also not have the best vascularity as well can be especially difficult sticks. And then it's not something we're doing every day. I haven't been doing for maybe a long time. So how are we getting this blood? And I think it's nice if you can have somebody that's doing it consistently. If you have nobody that's been doing it, to have one or two people in that practice or that office that are really going to work on honing this skill. It's also, I've seen it where if you have somebody in the network or depending on how the practice is set up, that can come that's highly experienced with performing the phlebotomy. There can be certain days where you have your patients where you're going to be doing all of your blood-derived products on Tuesdays and Thursdays. And so you have somebody that would come and be set for those particular days to assist. I think there are courses that can be somewhat helpful, but really practice makes perfect. And there are some interesting tools out there now that we have that can help with the visualization as well. So that's another potential option. But it is, I would say, with this process, I wouldn't define it as a barrier necessarily, but it is definitely it's a challenge for some of these.
Yeah, absolutely. I think it's easy to kind of rule out PRP because it's that part of it can be quote unquote difficult or an adjustment. But that's kind of been our same thing is it's an adjustment, but the outcome, the end result is much more it's worth it. It's worth it in the end, especially for the patients.
I was going to say, well, part of that conversation we had the other day, Christina, is secondary dressings. Do you have any recommendations or just like best practices when it comes to secondary dressings for this?
Sure. So, and that's also going to vary by the different products, even within this category, because some products don't necessarily have to, and this will continue to be the trend as more products come out. You'll have certain products where it's going to be critical to maintain the moisture on that wound bed, while also preventing, doing what you can to prevent any kind of maceration effect. And there's going to be other products in this category that are going to be a little bit more less of a liquid state and more kind of dried, and you're not going to have that concern as much. And I would say having the plasma and the nutrients, electrolytes, hormones, there's definitely a huge advantage to having that there. But then comes the challenge of how do we go about what's the best way of dressing these. And so with the PRP gel, for example, with Regen Wound, it goes on the wound. And this is also, I think, another thing that's worth mentioning is that this is quite flexible. So they can stretch and they can mold and they can fit this perfectly to fit the wound bed. So if there's undermining, tunneling, they can almost, we see where providers will almost do a jigsaw puzzle and be able to cover all the topical wound bed, which I think is quite nice. But once the gel's been applied for the, I guess what you might call the primary dressing that would go over that, you could either potentially use a paraffin wax gauze, or you could use a petroleum jelly gauze. And remember, the key there is that we don't want to have anything like a foam or dry gauze that's going to essentially pull the plasma that contains those growth factors, platelets, nutrients off the wound bed. And so once that's in place, you would then place the secondary wound or a wound dressing on top of that. And that's something that you do want to be able to absorb any exudate, any runoff very effectively. And then we have most providers that will then do a wrap and any kind of appropriate compression therapy if it's necessary, or offloading.
Great. Thank you so much.
Thank you so much. That was a great first interview. That was really good.
Thanks, guys. Yeah, happy to do it. Appreciate your time.
Okay.
First, thank you, Robert, for joining today. Just give us an introduction of who you are, your background, and the product you'll be talking about today.
Great. Thanks for having me, Kallie and Christina. My name is Robert. I'm the general manager for RedDress USA. We have an autologous blood-derived product. I've been in the med device space for 15 years now, ranging from trauma ICU, urogynecology, and now wound care. So excited to be here and talk about the lovely world of wound care.
Awesome. Well, thanks, Robert. We're super excited to learn more about RedDress. Kallie and I were talking in SAWC spring. There was 2 PRP products, and then SAW fall, there was 4. And so we just see, especially with all the changes happening in the industry with CTVs, that, PRPs is kind of the next big thing. And we wanted to, as it's still manageable with 4 companies, really learn the differences of each of your companies. And I think RedDress especially, you're so different than your other PRP companies. And so just learning more about that. Where do you see PRP going? Do you think it is the next big thing? Where do you see the future?
Yeah. I mean, it's funny that you say it's like the next big thing because PRP's been around for such a long time.
I know.
Right. And I think, people have used it for years and had, great results with it. Now that kind of the space is changing with the coverage, the coding and coverage between, the blood-derived products category and CTPs, it's starting to become, I think, more popular in the classic kind of wound care channel. We have spent a lot of our time generating clinical evidence around the classic DFU, VLU arena and wound care. And for us personally, I can't speak for the rest of the companies in the space. Outside of the classic wound care space, we're focusing a lot on doing research in other kind of surgical arenas. The product has both. We could do both in a patch and a flowable format. And we find that flowable format is really a solution that, when there's those tunnels undermining fistulas, tracking, gives you a great solution on how to attack those wounds. And that drives some of the clinical research in that area. So I think we'll see a shift really cementing itself in wound care and then starting to shift to that surgical side as we go forward in the next few years.
Okay, awesome. And with all of the different products and yours being so different, can you talk about how yours is different than the other companies, and maybe the process, the product packaging, how is it stored, all of those things?
Yep. Yeah. So Actigraph is a point of care kit. So it's just a little box. It has everything you need in it to do the procedure, ranging from the blood draw components to the procedure itself, the secondary dressings. And so the story I like to tell folks, it truly is point of care. I had somebody in Indian Health once call because they were going to the patient in the reservation desert area. They were not able to come into the office, and they just took the kit and went. As long as they had the blood draw capabilities, they were doing that in the field. So I'd say, first of all, this is truly a point of care solution that folks can stock and use in their facilities. It is quite different from some of the other products in the space. We don't have a centrifuge, and there's a clinical reason behind that. The summary I'll give is, if you think about a blood clot, that's actually the body's natural skin substitute. When blood clots, it creates a fibrin matrix, and whole blood retains all the cells that are naturally required to go through the healing cascade. So all we're doing is basically tricking the body, thinking a chronic wound is an acute wound, starting back at that hemostasis phase, and then starting to work through that process again as we give it the ammunition to continue the healing process. So there is a very significant clinical reason around why we don't have a centrifuge. But the process itself is pretty straightforward. We draw the blood. That takes a few minutes to do. Then we actually coagulate the patch, which takes about 5 minutes, and that's inclusive of patients on blood thinners. So it ends up being something very quick. And the nursing staff can all do all the prep work to get the patch ready. And once the patch is ready, you have an hour to do the application. So typically the physician will come in, do their debridements application, and move on. The good news also is that this is all ambient temperature storage. There's no refrigeration, in addition to the centrifuge lack of centrifuge. So it truly ends up being a pretty easy and straightforward process to manage and deploy in a clinic.
Awesome. And how long would you say your process is from start to finish?
Yeah, it would take, we do it normally in a typical clinic window. So normally you're booking somewhere 20, 30 minutes for an appointment, and the whole appointment gets done in that window. The blood clot itself, in terms of actually forming, it takes about 5.
Okay, great. So, in talking about processes, the feedback we got, because we are doing PRP, I'm just kind of trialing it in a few of our centers, and the biggest hurdle is the blood draw. It's one, a lot of us wound care nurses haven't had to pull blood in a long time. And so we're just not as confident. And then the second is, these patients that we're dealing with is an older population. So they're hard sticks.
Yep.
Do you feel that those are the same hurdles you're hearing with your clinics? How are you kind of getting through that? And does your product, because it is slightly different than the other PRPs, do you have any other hurdles we're unaware of?
Yeah. I mean, so starting with the blood draw, it is a blood product, right? I think for the category, they haven't invented needleless blood draw yet. So when they do, we'll be very interested.
Let us know. Let us know when that happens, Robert.
Exactly. So, I think that there are a couple tips and tricks that you can do. First is always coach the patient to hydrate, right? And coffee is not hydration. So, water, a lot of times when folks show up to the clinic, they'll just give them a cup of water while they're in the waiting room before they come back to the procedure room, just to make sure that one last step of let's give ourselves the best chance to do this. Most of the time when it comes to the clinics, we find that I would say 60, 70% of the staff are kind of like yourself, where I used to do phlebotomy or blood draws, right? It's like riding a bike. I just kind of have to, do a few sticks to kind of get back on the bike again and start pedaling. And so once we get through those first few, generally that helps them a lot to build their confidence and continue going. One thing that is unique for us is that you could decouple the blood draw from the procedure itself. So what we'll see a lot of clinics do is, while the patient's in the waiting room, draw the blood, label it, put it back in the kit. And so that way there isn't this, you have more flexibility in terms of the blood draw process itself. And they'll also set up like a clinic day where it's the Actigraph day. So on Wednesdays at, 10 a.m., we're going to start this, and we're just going to do the rest of the day for patients. So you kind of get into that routine then of doing that process. And then the other thing I would say that is helpful, we find that there's these vein lights that illuminate and help stabilize the veins. So sometimes there's tools that you can use to kind of help for those difficult patients.
Speaking on patients, what are you guys seeing in terms of patient compliance, and how often are they able to get into the clinic to receive this treatment, and like how often are those visits?
I think the standard is, once a week. I think in, some instances you could get them, multiple times a week if that patient is super compliant and engaged in their journey. I will say that we find that there's always this interesting conversation that happens with the patient and the clinician now is, hey, listen, patient, I'm going to use Kallie as an example. Hey, Kallie, I'm here to help you on your healing journey, but you're actually going to heal yourself because I'm going to draw your blood and we're going to create a patch and we're going to use your body's own mechanism to heal itself. So there ends up being this kind of transmission of almost responsibility and accountability on the healing process back to the patient, where you can have this interesting dialogue that starts the process. And generally from there, you'll go to a weekly application as you go forward. We do see that, if there's somebody that's going on vacation and let's say they can't come back on that Monday or Tuesday, see them on a Friday, that's fine. They can do that. And that works out pretty well.
Oh, thanks. Yeah, I like that, during that patient education, it does kind of put that ownership back onto the patient. Like, I'm doing this myself. You're just helping me, right?
Yeah.
So that's really great. So thank you for that. So another thing that Christina and I were discussing prior to these interviews, and we've kind of been trying to ask everyone to keep it, fair, that you guys are all getting the same questions. Talk to us about dressings. So primary, secondary dressings. Do you have any best recommendations or best practices? Because in our clinic, like we said, we're trialing these, and it's kind of like trial and error. This one works, this one doesn't. So we just kind of want to see, what's your take on that?
Yeah, every patient is different. Every wound is different, right? So it does, I think, take some clinical assessment to kind of figure out what the right dressing is. Our kit comes with a standard where we have a non-adherent pad, a 4x4 foam, and that's at least the baseline. But I think what you will find, at least with Actigraph, given its whole blood and you've got that extracellular matrix and you've got all those cells, it wakes the wound up, right? You basically go back into this inflammatory phase. Macrophages go in, they start to chew stuff up, exudate goes up, right? So you really have to spend some time communicating and educating with the patient around, if you get strike through in the secondary, that needs to be changed. Perhaps you can get them back into the clinic to do a mandatory change during the week. We do have a dressing guide that goes through, like, these are different scenarios around where you might think about using these types of dressings. And then these are the products in that category that you should think about. So, but definitely encourage clinicians to, counsel patients and watch the secondary for, No, we're very excited to be working with you all. And I think that, maybe one last comment is what we've seen a lot of folks start to think about this category, right, as a useful tool in their bag. It's not the only tool they should have, but probably one of the many. We call them the lost patient groups. So it's, Medicare Advantage patients, typically those are difficult to find covered advanced therapies on. And with the national coverage determination in this category that offers basically universal coverage for Advantage plans, patients with exposed bone and tendon, those are areas where, again, there's not a lot of options. And so we'll see people really start to gravitate in this area for that. Irregular wounds or those tunnels and tracks, right, where you have that flowable option, that tends to be something where you don't have another solution on. And then finally, like religious patients. So there truly are a lot of folks out there that have beliefs that they don't want other third-party products on their body. And this category ends up being a solution for them, that can meet their religious requirement along with their healing goals. So I think we start to see people really think about using this in those categories first and get comfortable because they're solving a problem they have every day, helping the patient, which they need something to do. And then as they get comfortable, then they start to expand and think about how they approach their patient population thereafter.
Thank you. That was really great insight. I love that.
Yeah, for sure. Things that I guess not a lot of us has been thinking about, right?
Mhm.
Especially the religious aspect, who's thinking about that and what are we doing for those patients? So I'm glad that there is this option for them.
I'm just excited to see the podcast, and if there's more topics you want to cover in the future, don't hesitate. Happy to participate.
Cool. Thanks, Robert.
Well, thank you.
Thanks,
Bye.
Thanks, Kallie.
Yeah, well, I am very excited to be here and be talking with both of you. My background has been in orthopedics and biologics for the last 15 years. So I started out at a company called Arthrex, and Arthrex was really is the PRP leader in the world. They run about 35% of the world market. And I launched several of those products to the sales force when we were there, as well as other skin graft, amnion products, and bone grafting, things like that. And in my time there, we ran across a lot of wound care opportunities, but we were an orthopedic company. Fast forward to 2021, this company, Nuo Therapeutics, reached out to us because we had a previous relationship with them. In 2012, they transferred ownership of the Angel system over to Arthrex. So we knew who these guys were. We knew how great their technology had been. And so they reached out to us and said, hey, we received a national coverage determination on the Oryx system. And fast forward to 2022, we came over to re-commercialize the system with them. So that's how I ended up here. And that's a little bit about who I am and kind of the background in PRP that I have.
Awesome. Thank you. So Kallie and I talked about how SAWC Spring was really when we first met, you and another company where kind of like PRP started off with 2 companies, and then spring, fall, now there's 4. With all of the CPT changes, where do you see PRP going? Is it the next big thing? Is it where we're all going to head to in wound care?
Well, I think it is going to be a big thing. I don't know if it's going to be the big thing. And the reason I say that is I don't think there ever should be one therapy that's the big thing. I think the skin sub things that happened over the last few years probably shouldn't have happened. But I think there's a place for wound vacs, for HBO, for debridement, for good wound care treatments, no matter what the modality. Now, I think PRP has a unique place in that the healing rates are really, really high with PRP, especially on tough to heal patients. So I do think we're going to see a larger portion of the market move to this, much larger than current, certainly. And we know of several companies looking to get into the space. So I think you're going to have some firepower behind the PRP world with some bigger name companies. We're going to be one of those big name companies. But I do think that it will become a standard of care in every wound care center. So I think you're going to see it, the conversations we have now are, we don't draw blood, right? And we had those same conversations 10 years ago in sports medicine. And fast forward to now, every sports medicine group has a PRP person because the data has caught up as it has in wound care. And there was a revenue stream and the patients did really well. And that's what's happening right now in wound care. So I think, the data's there, the reimbursement has caught up, and the patients do extremely well. So I do think it fits well into the algorithm of a wound care center. And I do think it will be a standard of care. And I think it'll be a lot bigger than it is now, but we'll see if it's the big thing. We'll see. I hope.
Yeah, no, I love what you said. And, we're such big proponents of that too. There should never be one thing that we're all relying on. Wounds are so different. Our patients are so different. And it should just be another thing in our toolbox to choose from, to be able to give our patients the best ability to heal. So I love that you said that. Let's talk more about Oryx. So can you kind of compare your product to the others that are on the market? What makes you a little bit different? How's your product stored? How long does it take? All of those things.
Yeah, well, that's a loaded question, right? I'm going to tell you all the things that I love about Oryx. So I'll start with the other companies out there have really cool products, and they're cool in different ways. We think we have the best mousetrap, and I'll walk you through why. So the first thing that I think is key is we are an American company, 100% American made, and we helped to develop this code with CMS. So we have an intimate understanding of this code and how it works, and we were involved in overturning the non-coverage decision. So from just an investment standpoint, our company is the company that made the investment in getting the reimbursement done. So that's something I think is important to remember with this whole process. But yeah, I'll give you the quick hit points on the Oryx product. So one of the great benefits of this product is you only need about 3 to 5 cc's of blood to treat a pretty large DFU. If you want to collect all the blood you want in the kit, which is up to 30 cc's, we can treat a 2,000 square centimeter wound. So I'm unsized, and I have a limited sizing because you can expand my kit with more tubes. So on those really large wounds, financially in a wound care center, those are hard to treat. But with the Oryx system, you can treat them. And because you have 20 weeks of therapy, because you usually see about a 50% reduction in 2 weeks with the Oryx product, those big wounds get small quick. So that's one of the benefits is we don't need a lot of blood. The second is we can cover a large wound. The third is our centrifuge is very small. It's 4 pounds, 7 inches across, takes up minimal space, and it's a 52-second spin. It's super fast. So our whole process, usually by the second or third time your staff does it, we're about 6 minutes on average. The only variable piece of that is the blood draw. The centrifuge is something I think is worth bringing up. PRP is an important piece of this. There are some other blood therapies on the market, like, for example, RedDress Actigraph and Reapplix 3C. Those are blood patches and clots. But PRP is concentrated growth factors. What the centrifuge does is refine those growth factors and concentrate them. And then we add in our pharmaceuticals. So the spin time, the prep time is fast. The blood draw is small. The coverage is large. And the key component to this system that is more key, and that's the reason we have our awesome data, is the vitamin C. So our kit comes with some pharmaceutical reagents that really increase our healing time. So when we did all this data collection back with Curative Therapeutics back in the late 90s, they had 3 studies they did with the FDA on platelet concentration and which ones heal wounds best. And that's where ORCs came from. But in that whole process and through other publications, we realized these wounds are all deficient in vitamin C, all of them. And they're almost in some stage of scurvy because there's poor perfusion down to the wound. There's chronic inflammation. They're on a multitude of drugs, blood thinners and things like that. And no matter what the patient does to try to change that, the perfusion does not get the vitamin C there. So when we include that in our product, we get rapid collagen formation. Vitamin C is there to cross-link those collagen fibers into that super tight triple helix of type 1 native collagen. When vitamin C is not there, you have a loose winding, those wounds reopen, or you get scar tissue. So the vitamin C is one of the components that this system really makes this system special. And we're one of the only companies that can put that in the system per the FDA regulations. Why we think we are, one of the better setups of a system and why our system has the amazing 81% 12-week healing rate that we had in our RCT. And we did, on our level 1 study, we overturned a non-coverage decision with CMS with our study. And Medicare wanted to see how we could treat a real Medicare population. And so we had an all-comer study. We had Wagner grade 3 and 4 wounds. Almost all the wounds were Wagner grade 3 and 4. We had to include comorbidities. So we had to include smokers, peripheral artery disease, obesity, the things that get cut out of all these other studies. And we had to test it against whatever these centers used, including advanced therapies. They all used HBO, skin subs, or wound vacs. And at the end of that study, our healing rate was 37% higher than the standard of care in those centers. So very compelling, which is why that national coverage decision was awarded.
Yeah. There was something that you kept mentioning that I was going to ask next is we've obviously been using PRP in a few of our centers as it's come out. And one biggest challenge that our clinicians gave is the blood draw. Most of us haven't had to do that in a long, long time. Some of us, if we've done only wound care, haven't had to do it. And our patients are older. They're a hard stick. So what kind of is that the challenges you're seeing in other centers? How have they bypassed that? What would be some of your suggestions if this is kind of a hurdle that a clinic, it's the reason why they don't want to try PRP?
Yeah, that's a great question. And that's something that initially 3 years ago, we got from a lot of hospitals is we don't want to do blood draws. We don't know how to do blood draws. What we're finding, and again, this tracks almost identically to what we saw in sports medicine 10 years ago. Nobody had MAs that could draw blood. None of the sports guys had drawn blood since medical school. And what we're finding now is that there's certainly a willingness to try. So we're getting over the hurdle of we don't want to do it. The reimbursement changes certainly are helping people say, okay, definitely want to try, given that there's some reimbursement there. But once they do it on a patient and they see the healing, that's where this idea of, I don't know if we want to do it, then it's, okay, we want to do it. Now let's see if we can get blood out of this patient, right? And so we've overcome that hurdle in most of our centers. And there's some best practices that we are implementing to make the blood draw easier. But you are right. These patients are really sick a lot of the time. They're really hard to get blood out of sometimes. I'd say on average, 5 to 7% we can't get blood out of. And that's why I think, again, we fit in a great algorithm of wound care. you bail and go to another product, a skin sub or something else. So, but typically the best practice is have the patient hydrate a lot before they come. And we had the same problem, and even in sports medicine, even young teenagers would come in super dehydrated. You couldn't get blood out of them and come back a week later, drink, 40 to 60 ounces of water before you come in. And they got these big juicy veins then, right? So hydrating is key. And I think that is always a challenge with some of these patients and their nutrition is just be hydrated. We have improved some of the needles in our kit. We found that there were some problems with the needles. Some of the people didn't like the needles. So we've put some a much easier flashing needle in our kit. I think that every company is going to have some of these problems. And then we're exploring other options. We are partnered with a national phlebotomy group. So if a center can't do it or doesn't want to do it, we can have an outside group come in and do it. The other thing we've explored is things like vein finders and all that. But generally, we don't have that issue on most of the patients. And especially, it's funny, a lot of these patients who've dealt with these stalled wounds for a long time, they're a little nervous and apprehensive about that first blood draw, even though they get stuck all the time in the hospitals. And then when they come back and that wound is, 25, 30% healed, they go, hey, stick me again. Let's go. Let's heal this thing, and within 6 treatments, they're usually healed most of the times. So again, yeah, we understand that it's a change in paradigm in the wound care world to start drawing blood. But I do think it's not really a matter of if, it's more a matter of when you're going to start doing it, because there are other companies getting in. Now that the code is fully reimbursed across all points of service, and now that the skin subs are potentially going to go under some changes, it's a great option for centers, from a revenue standpoint.
It actually kind of leads right into what I was going to ask, Dave. You talked about what can help with the blood draw is making sure clients are hydrated, things like that. What are you seeing with patient compliance? How often are they need to come in to, receive this treatment? And just anything that, could help with that patient education factor.
Yeah. Well, I'll start with the patient education factor because I think that's really important, right? I mean, wound care oftentimes is a challenge of compliance, and we all know that, and we've dealt with that for years. But we have a really nice, clean patient explainer video that's an animated video that talks in layman's terms about what we're doing and about what we see with these with our data and these wounds that are healing. We find that a lot of patients, once they watch that, they say, okay, I want to do this. I want to try this. So that's really helpful. And then we have some standard operating procedures, and we have some pre-treatment protocols we like to give to patients to talk about hydration. Hey, don't drink, only coffee the morning of your blood draw. Go drink some water. But as far as compliance goes, we do rely on the patient to be somewhat compliant, right? They have to drink water. They have to be willing to get their blood drawn. But the cool thing about this product is the rest of the compliance is lower than some other products, right? Because once this goes into the wound, we put either a Mepitel or a Tegaderm that's fenestrated over the top, and they can go about their day. They can have pressure on it. They can walk on it. They can do whatever. And this is still going to work really well. Unlike other products where you have a graft or a clot or something else that you don't want moving around. This product, once it flows down into those areas, is going to activate those receptors and it's going to start its healing process. So,
yeah, thank you. And actually, you literally led right into the next question. Primary dressings, secondary dressings, best practices, recommendations, right? Because it's kind of like right now, trial and error for what works for each patient, right? Every patient's different, every wound's different. But just from your perception, like what is the best practices for that?
It is 100% a trial and error scenario. So when we first launched this, we were recommending doing a Tegaderm that's been heavily fenestrated. And that works great. What's funny is in the wound care world, the Tegaderm is less popular than in the sports med world where everybody uses it. So we realized that, okay, maybe we got to talk about something else. But what we found is something like a Mepitel works really well. Something that has fenestrations in it that can breathe, right? So these are wetting products. It's going to wet the wound a little bit, and we don't want maceration. So anything that can breathe is what we're looking for. We want to avoid things that are petroleum based, because like an Adaptic that has Vaseline on it. If you have the Adaptic that doesn't have Vaseline, great, go ahead and use that. But if it has petroleum, that's going to be somewhat cytotoxic to the cells. We want to keep that out. But as long as it can breathe, so our kit comes with a contact layer veil dressing. You cut that down to size, put it down in the wound, holds the PRP in place. Then you throw your Mepitel or your fenestrated Tegaderm or whatever, your breathable primary layer dressing, then just some absorbent dressing over that. And our product is usually viable for 2 to 3 days. I recommend leaving it on for 3. You can leave it on for the full 7 days between treatments, anywhere from 5 to 10 days. Once a week is kind of what we recommend. And it works great if you leave it on. But if you have somebody with a heavily exudating wound and you're worried about maceration, then home health or the patient can remove all of those dressings after 3 days and just do an absorbent dressing after that. And you're going to have the same result with the product. No, I mean, we're just super excited. We love the Wound Care Advantage relationship. You guys have been fantastic, really, as far as introducing new technologies to your accounts and holding the account's hand to learn the new technology and go through the reimbursement and know that the reimbursement's going to be there. Because what you find is some of these other management companies, they just throw a bunch of stuff in and you got to figure it out on your own. So we've really enjoyed working with y'all, and you really have been an advocate for your customers with us. We've had to develop some things to help your customers. So we like this relationship a lot. We're really happy with what you guys are doing. And we do think this will be one of the standards of care pretty soon.
Yeah.
Yeah, so do we.
Thank you, Dave, for always willing to participate in any crazy idea that we
have.
Well, I enjoy it. I really do.
So good to have you with us, Daniel. I'll go ahead and let you introduce yourself and who you're with.
Sure. Hi, everyone. My name is Daniel Andrews. I'm the Vice President of Sales and Marketing at Reapplix. I've been with the organization for 3 years and part of the executive leadership team.
Well, we're so happy to have you here, Daniel. Could you tell us more about your product and how it stands apart from all the other PRP products on the market?
Sure. Love to. So one of the things that attracted me to this organization was just how differentiated the technology was and just how disruptive it could be. And being a 20-year veteran in the advanced wound care space, I saw that the time was perfect for this technology really to find its way into our centers as an adjunct to the already advanced therapies that our providers have available. And so the things that really stood out to me that drew me to this organization was that 3C patch in this category isn't necessarily a PRP. It's actually a leukocyte fibrin patch. It's a physical patch that's made 100% from the patient blood. It's 100% autologous. So what does that mean? It's 3 layers, and that those 3 layers all have a unique benefit for advanced wound healing. Primarily the leukocyte layer. You don't get the leukocyte layer with traditional PRP, and it's that leukocyte layer that plays a critical role in handling bioload, handling foreign material that's in the wound. And it's really that leukocyte adjunct that begins to set the cascade of wound healing as a start of the healing trajectory of the wound. So that was quite unique. And because it's a physical patch, you actually can handle it, manipulate it. It's a physical structure that you actually will use your forceps to place into the wound. You can cut it, you can fenestrate it if you need to. And then in addition to that, the platelet layer, these inventors of this technology found a way to create a very efficient platelet layer for the 3C patch, which captures roughly 98% of the available platelets. And that's not something that you'll get with traditional PRP technology. So that was, something that I thought was quite unique. And then as a physical patch, you also get more of a sustained release of the bioactives as opposed to a gel. Because of that fibrin structure, it's going to be able to deliver those bioactives at a more sustained rate over an extended period of time. And then lastly, I'll share that it's an automated process. And we can talk about each individual step if you like, a little bit more in depth. But with 3C patch, you're drawing the blood. You take the 3C patch device, which is your vacutainer, and you put it into the centrifuge, and you hit start, and you go back to doing what you normally would do during the patient intake process. So it's 100% automated. You're not having to measure, concoct, mix multiple injections and such. You literally draw the blood, put the device in the centrifuge, hit start, and the centrifuge creates the 3-layer patch for you.
Awesome. Well, thank you for that. Kallie and I were talking about PRP and how earlier this year at SAWC there was 2 companies, and then SAWC fall there was 4 companies, and it's going to keep growing, especially with all the big changes in the industry. So, where do you see PRP going, and what do you think it's the next big thing? What do you see for the future?
There's no question. I think when we go back to our schooling, right, back to medical school, we're taught that it's really hard to be autologous. What we've learned in the world of advanced wound care is that autologous is tough to beat. And so but the challenge has always been having something that would seamlessly fit into our workflow that made sense to really implement in the outpatient wound care space, right? And since then, we've been able to create a technology that absolutely can do that. It can deliver an autologous based solution that's from the patient. The patient is the product, and it's hard to beat that, right? But so again, we just haven't had something that made sense that fit into our workflow until now. And so with 3C Patch, it was our randomized controlled trial, which played a big part in CMS creating this category. Right? This new category that is reimbursable in the outpatient space. And so, yeah, it has opened up the door for other blood-based therapies, which you're seeing. And yet there's no question it's now possible. It's possible to have an autologous option in your outpatient clinics that makes sense from an operational clinical flow standpoint. And so when you think about autologous versus exogenous, it's a no-brainer. The patient is the product. And so it is going to be the next greatest growth category in regenerative medicine for wound healing.
Yeah, we think so too. Just kind of hearing from all the companies, and it's not a new technology, right? Like orthopedics has been doing it, other areas have been doing it, and so now it coming into the wound care space is really exciting. Let's go back to your product a little bit, and can you share with me how your product's stored compared to others? What are the biggest differences you would say with the other companies that kind of make you stand out, besides kind of your description of the product, but more of like, how do you what do the packages look like? Do you have to refrigerate it, not refrigerate it, things like that?
Yeah, absolutely. No, so it's provided as a disposable kit. It's roughly 6 inches wide and 1.5 inches thick, little box, right? And in that box, you have everything you need for the procedure. It has your needle, it has your needle holder, it has the vacutainer. It also has a little alcohol swab for conducting the venous puncture. And then we also have a little bandage for the venous puncture site. So everything that you really need for the procedure is in the disposable kit. And that kit has a 2-year shelf life based off of date of manufacturing. So it just has to stay at room temperature on the shelf, does not take up much space. But of course, you need the centrifuge, and it's the centrifuge that's really a big piece of the innovation. But here at Reapplix, we provide that centrifuge to our clinics. It's not necessarily a upfront capital expenditure. We keep it really simple for our clinics to make sure that they have access to 3C Patch.
Perfect. And then, the biggest hurdle we've talked about, but also kind of knew what was going to happen, is the blood draw. Most of the time, the nurses in the wound care center haven't had to do that in a long time, or if ever, if they were in wound care their whole career. That seems to be the most difficult challenge. Is that something you're seeing? And how are we, or you and other facilities, overcoming that challenge?
Sure. Well, typically their nursing license allows them to do blood draw. It's within their scope of practice. Now, like you mentioned, some nurses that are in wound care and have been in wound care for a while haven't done blood draw in a long time. Some cases not since nursing school, right? And so what we always do is we recommend a blood draw competency refresher, which is something that our nursing teams are familiar with. And typically it's someone within the nursing education department at their partner hospital that can do a refined or an inundated blood draw competency for our nursing team. It usually involves doing a few sticks, maybe shadowing a phlebotomist for a day in the inpatient space. But again, it's within their scope of practice, but it's always just a good, best practice to do a blood draw competency to kind of dust off that blood draw skill.
So talking about, blood draws, things like that, it kind of leads me into patient compliance? How does that look for, patients that are receiving the 3C patch? What is their treatment schedule, right? Once a week? Are they, what does it look like if they go longer than once a week?
Good question. So just like you would with most other advanced therapies, you're going to have the patient come back on a weekly basis, assuming that their schedule allows this and they're committed to this. It does take a commitment from your patient, right? And so you want them to come every week. And when you look at the evidence, the randomized controlled trial that was done on 3C patch, these patients came weekly, received 3C patch on a weekly basis. And so that's what you really want to do. And you want to have your patients commit to that. Now, compliance. It's greatest challenge in wound care, right, is gaining commitment from your patients to follow the treatment plan. And what we found with 3C patch, and this is anecdotal, that the patient, because they are part of the process, they are the product. They're creating the product. It does open the door for a unique conversation between the provider and the patient about the need to hydrate, the need to, maintain proper nutritional best practices and status, right? Maintain, good blood sugar levels. All of these things play a role in the healing potential of those patients. And I've seen providers where they'll play to that. They'll talk about, we need your help. And if you can continue to show up and you help us in these two areas, watch your nutrition, help with your A1Cs, you may get a better patch, right? They play to that. And we've heard over and over again from centers that we've launched in that they're just super impressed with the patient engagement. We oftentimes find that it's the patient caregiver that's coming along with that patient that just gets really super engaged with the technology, and they start like teaching the other nurses about 3C patch, which is kind of fun. So at the end of the day, I think it's something that makes sense to our patients. It makes sense to the caregiver. We're going to take your healing capabilities, okay, and we're going to just take them out through a very large vein, and we're going to concentrate them down and take your own living cells and your own living healing capabilities and deliver them to your wound.
Yeah, it's kind of been the same across, all of our conversations, is that having the patients understand I'm in charge of this, I feel like is making a big difference. So yeah, great answer. I love that explanation. And I love that physicians are, understanding that they can play to that and really make sure that the patients understand that this is them that's healing,
Absolutely.
And so that kind of goes into one of our last questions is dressings, right? Because patients are always going to have, everyone's different. There's going to be more exudate, less exudate. So do you have any, recommendations or best practices for the dressings that cover the 3C patch?
Sure. So the kit actually comes with a primary dressing, and the primary dressing is a product made by Coloplast, and it's a silicone, non-adhesive primary dressing, which is perforated. So it does allow fluid to be pulled from the wound bed itself. But as the old adage goes, if it's a drier wound, we need to add moisture to it. And if it's a wetter wound, we need to pull moisture away. So choosing the secondary dressing based off of how the drainage presents itself is really, really important. So if you do experience an increased output of drainage, then you're just going to want to choose a secondary dressing that's highly absorptive, like a super absorptive dressing. You can also use negative pressure with 3C patch. So if you do have a significant output, then yeah, absolutely use a negative pressure device to help pull that fluid through the primary dressing. You can also use different antimicrobials. There's no contraindication for antimicrobial dressings. So as long as it's not cytotoxic, you're good to go. The last piece I'll add is that it's just, we're at a unique time in the world of advanced wound healing. And so it's really important that you prepare for, any changes that may be on the horizon and look for evidence-based therapy that could be that new tool to add to your toolbox. Wound healing is a very, very challenging science and practice. And so it's important that you have a diverse portfolio of advanced therapies that you can reach for. And lastly, what I'll share is with 3C Patch, you should have confidence in the therapy because it is supported by a large randomized controlled trial that was independently led, and it was published in the journal, Lancet Journal of Diabetes and Endocrinology. And there was over 269 patients in that randomized controlled trial. And what they found that 3C Patch significantly improved the likelihood to heal over a 20-week period by 89%. So it's backed by a very large randomized controlled trial. And then lastly, I'll add is that because of that evidence, we're very proud that the International Working Group for Diabetic Foot, they actually recommend the use of a leukocyte fibrin patch for the treatment of non-healing diabetic wounds. And there's only one leukocyte fibrin patch in the world, and that is 3C Patch. But they do not recommend other blood-based therapies because they don't have the evidence that would substantiate them as it stands today. So something to think about. We are backed by the product, not we. The product is backed by a very valid randomized controlled trial, and that's something that our providers should feel confident in wanting to explore further for themselves and their patient population.
Yeah, definitely. Thank you so much. Again, we appreciate you taking the time out of your busy day to come and talk with us and kind of explain, what the 3C patch is and how it differs from the other products. It definitely, made me realize how you guys stand apart as well. And I know Christina and I both are kind of like have this big like category now of all the different PRPs. Like this one fits here, this one fits here. So yeah, thank you so much, Daniel.
Well, it was just so great to learn more. And I know our listeners are going to find it valuable too. So thank you.
Thank you, Christina. Thank you, Kallie. Happy to be here.
Kallie, that was like so much information. It was a lot, but I also feel like it was really good.
Mm-hmm.
I learned a lot. I don't know about our listeners, but we promised you guys a bit of a summary.
Yes.
So we're going to go over it now. Again, it's not going to be full on all the information because obviously then this episode would be too long. You guys can definitely go back, listen to the interviews themselves, but we think we're just going to hit on like the key points that we think really make them stand out and why they're different from one another.
Yeah.
Which one do you want to talk about?
I think for me, it just makes sense to go in order as we interview them, right? Just to keep it simple. But we're just going to really, unwrap each interview in under 30 seconds. Again, we want you, if you have time, go back, listen to the interviews because there really was so much good information. And you'll learn that like Christina and I both think there is a place for every single one of these products. It's not like one against the other, right? There is really, truly a place for all four of them. It just has to, you in your center have to figure out which one works best for you guys. So let's just start with the first one that we started with, which was Regen Labs.
Okay.
So key points. No, we were laughing, you guys, because we literally were taking notes and we're like, how do we pronounce these words?
You guys, I may be a nurse, but I can't pronounce some of these words.
But not science. Like
we don't want to butcher it. Yeah.
I know these are straight scientific words. And you know what? Hey, people say that if you don't know how to pronounce a word, it's because you learned that word by reading it. And I feel like that's how it works.
Okay. Go ahead, Kallie. Regen Labs.
Okay, so biggest takeaway is that Regen Labs uses a thixotropic gel, separating gel, that fractionates, which is a word. We did look that up.
It means to divide.
Separate would be a good one, but you can't say that because separation gel. Okay, Regen Labs is a thixotropic separation gel that fractionates the blood, that increases the platelet growth while also decreasing red blood cells and neutrophils. As Christina, you probably know way more than I do, chronic wounds, they have an overabundance of these neutrophils. So it's really good that, they can go in and decrease that while also promoting that new growth. Also, Regen Labs does have a centrifuge. It does create a gel. So as you hear us, we're going to be talking about, what comes with each of these products. So in a nutshell, under 30 seconds, Unwrapped Regen Labs thixotropic separation gel is that key phrase with that one, which goes into the next one, which is RedDress.
Yeah, so RedDress is super interesting. This one has no centrifuge. And so if you're looking at out of all 4 of the products, like, and you don't want to invest in a centrifuge, like this could be possibly one that you want to look at. So it is a whole blood clot. I just want to be real honest with you guys. Out of all 4, I will say RedDress is the one that, I mean, it represents a blood clot, literally. And so it is a patch, but it also can be a liquid forming clot, and it's for tunneling wounds. So I think if you're limited on resources and you cannot get a centrifuge or don't have the capital to, you could totally use this. If you have those larger wounds that have tunneling areas and you want to be able to manipulate the product in a gel, in a liquid, versus just having a patch, you have that option actually with RedDress. You can go either or. So that one's really nice. You have a little bit of versatility there. But I think the biggest thing for me is the fact that there is no centrifuge. So I will say with RedDress, the comments, the feedback we've heard out in the industry is that this one can possibly have a little bit of odor because it is a blood clot. And as blood clots sit out, it can have an odor. So something to think about when you're using this, and to kind of warn the patient so they don't get worried that there is an odor. I always try to, teach our patients, as certain products have different presentations after they've been on or have a smell, just so they don't panic and think their wound's infected. So yeah, so that's RedDress.
Yeah, I guess it really did stand apart without having that centrifuge. So that is a nice little component of it. The next company that we interviewed was Nuo Therapeutics with their product RX. So this one definitely stands apart as well because of the things that comes with the kit. So this one is the only one that does need to be refrigerated, but that's because it comes with vitamin C as a reagent, because chronic wounds, all of them are vitamin C deficient. And so this really helps promote healthy collagen and gets that beautiful triple helix, matrix, all the fancy words.
Fancy words. Yeah. No, and it is. I think that makes it definitely stands out. But pros and cons, right? Because I also think that's a con if you don't have access to a fridge.
Mm-hmm.
And you don't, everything that goes along with the fridge, logging it, all of that. And then you do need a centrifuge. Yeah.
And their spin cycle, I guess we didn't really capture that. So they all kind of have different spin cycle times. All of them, though, definitely go back and listen to the interviews because they really give best practices on how to make sure that clinic flow and the patient care is not disrupted with the spin cycles. So,
I also want to add with RX though, they only need 3 to 5 cc's of blood, which is huge. Because other products, I think you need more. And again, that's just, and I think once we finish the recap discussing the blood draw component of all of these, but I think that's something to keep in mind also, because more blood, longer sticks, all of that. But yeah. So then the last one we interviewed was Reapplix, the 3C patch. This one you don't need a fridge. It also has a centrifuge. It is a robust autologous leukocyte patch. And actually their kit comes with a dressing. So that's different than all of the other products. And the other ones, you just have to use what you have. But this one, they do put a dressing in there for you as well.
I will say the other ones come with some more basic dressings, right? But as a wound care nurse, you're not even going to look at them. But Reapplix, they do partner with Coloplast. So there is a Coloplast dressing in there for the primary dressing, which we both thought was nice to have. So
yeah. So that's kind of the down and dirty with those products. The question I really liked, Kallie, that you and I asked was the secondary dressing and the blood draw.
Yeah.
I think when we first started talking about PRP and talking with the clients, it's always that first kind of we have to draw blood. And let's be real, you guys. I've been a wound care nurse 15 years. I haven't had to draw blood in that amount of time. I can only imagine, especially nurses that went from other departments into wound care for the last 20, 30 years, you haven't done it in a while, or vice versa. You have a nurse that's only ever done wound care, is maybe a new grad, just something we're not comfortable in. And then on top of that, our patient population is older. They're just harder sticks. And so it definitely has been and still is a concern that we are talking through our clients with. I think they all really addressed it really well, don't you think?
Yeah.
They all gave us really good pointers.
I know. In fact, quite a few of them, almost all of them actually was a lot of centers are due PRP days, right? Where they have, the staff there that can do the sticks, things like that, which is well, that's an easy,
Yeah, dedicating a day And then if you dedicate a day, I think if you really want to take that extra step, you can just have your phlebotomist come that day. I have a facility that actually partnered with their lab and have somebody come up. So if that is an opportunity for you, great. I had another center that retrained all their nurses to have competency in it. Obviously, you need to have competency in it if you're going to do it. But they redid the education, made them feel more confident. So I think all in all, it's just what resources you have available in the hospital and what re-education do you have that you can dedicate to your team. Because I feel like practice makes perfect. Same with all of us. We weren't all good at wound vacs from the beginning. I could do it with my eyes closed now, but it's just that repetitive action and doing it. So I definitely think it is a hurdle, but a hurdle we can get over.
Yeah. And I think too, they all had really good ideas of have this conversation with your patient. You will be having your blood drawn today. Please drink water before your appointment, right?
Coffee doesn't count.
Coffee doesn't count. So I feel like really, again, we said this in our last episode, just talk to your rep, right? Whatever product you choose, whatever product you want to use, talk with them. They do have a team of experts, right? They usually have a wound care nurse on their staff that can help you with these. And I think it really shown that they do care about every step because they know everyone gets hung up on that one little fact about PRP.
Yeah, absolutely. The secondary dressing, that was something else our clinicians kept bringing up. Obviously, each product, I think, is going to give their recommendations to secondary. But as all of us know, it really just depends on what that wound is presenting with because every wound is different of what that secondary dressing you need. Don't just feel like because one company is recommending whatever, then that's what you have to use. I mean, definitely use what you think is appropriate for your patient to help mitigate that maceration that's going to happen, especially if we're using gel-like products like these that are adding more moisture and sitting on that wound. So just something to kind of be prepared for and proactively look at that the patient will probably get macerated. What can we do to mitigate?
Yeah. And I'll also say, take a look which one you decide because some you can use antimicrobials and some you cannot. So that's also something you want to look at when you're looking at what dressings to put on top of this.
Yeah, absolutely. And all in all, if you're listening to this podcast and you're still confused, you guys are more than welcome to email us. Ask us if you guys want more information. We have all the information of each product. We also have the contacts of all of the people we interviewed today. If you want to get connected, that's what we're here for. We're here to help you guys out. So reach out if you need anything, but we'll keep you guys posted too. We know the PRP world is changing because it's going to, and there's going to be more companies. And we just thought, hopefully this is helpful to you guys to stay on top of what is out there now, but we will stay on top of it and follow along if you want to hear more about it too.
I was going to say, and we're more than happy to also do follow-up episodes to this one as well, especially if, there is one company over another that you guys want to learn more about. Let us know. We'll be more than happy to kind of expand on that discussion with that company. Because again, we didn't want to take up too much of your guys' time. So short and simple. And, and so, reach out with questions. Also, something to be aware of is PRP really brings the patient involved into their healing plan. And so I think that was, for me at least, almost every single person mentioned when we talked about patient compliance is they don't see as big of a problem with patient compliance because the patients understand they're healing themselves. So,
I mean, it is something to be said when in a cool way too, right? You need me, one, to be there because you need my blood. It's my blood that's spinning or being clotted or whatever and being put back on my foot. And there was something that I didn't even think about, but I forget which company addressed it. But PRP as a whole, which is really cool, is for those of your patients that have religious or cultural things about certain products being used, all of these is their own blood. So it's really inclusive to that patient population. So that's always something as we look at CTPs and what, if they're bovine or whatever, and they can't use it, then this is definitely an option. But, last but certainly not least, thank you to all of the products for taking their time out and sitting with us on our humble podcast and teaching us more about the products because that's what we're here to do, to teach you guys. So thank you, everybody. And Kallie, anything else?
No, I think we covered it all. I'm so excited for you guys to all learn about everything that we did. Again, categories within categories of PRP. So lots more to come on that.
All right. Well, thanks, everybody. We'll catch you on the next one. Bye.
Thank you for listening to the Unwrapped Podcast. We hope that you found the information and insights provided to be helpful in your wound care journey. If you have any questions you'd like to be answered on the podcast, we invite you to connect with us on Instagram, LinkedIn, and YouTube. And place your question or comment under the Unwrapped Podcast post. We look forward to bringing you more wound care insights. Thank you for listening.